Big no.
Big no from all of us.
We're going to discuss the big C. The prevalence of functional constipation in children in Asia can go as high as 30%.
The most important food group is having fiber in your diet. I don't think milk is necessary, but at the same time, in moderation is good.
So the commonest cause of even obesity is eating without, you sitting in front of the screen and eating and snacking in between meals.
Though banana has got somewhat of a bad name where constipation is concerned.
JIVI Explains is a podcast started with one aim: to simplify healthcare information. Today we're recording our first ever episode, and we're going to discuss one of the most important but yet highly misunderstood topic, that is nutrition and constipation crisis in children. To help us understand this, we have three big guns of the pediatric world today. Starting with Dr. Ajit Gajendra Gadkar, the highly experienced pediatrician and neonatologist with over 30 years of experience. Welcome to the podcast, Dr. Ajit.
Thank you.
Next, we have Ms. Krushmi Cheda. She's India's first sports scientist and nutritionist. She holds a dual master's degree from UK in sports and health sciences and clinical nutrition. She's a former international tennis player, an ACSM certified trainer, and a Pilates instructor. She's also the founder of CORE, a clinic and studio dedicated to personalized nutrition, fitness, and holistic health. She works with Olympians, IPL teams, national level teams, and many young athletes. Part nutritionist, part magician, Ms. Cheda can turn your fussy eater into a high performer. Welcome to the podcast.
Thank
Ms.
you.
Cheda. We have Dr. Juvi Manke, a leading pediatric surgeon with over 20 years of experience and more than 8,000 surgeries to her name. She specializes in minimally invasive and robotic procedures. She's known to perform surgeries in children of all ages and also infants who are just a few hours old, which speaks volumes about her surgical precision and compassionate care. Dr. Manke's mission is to give each child a fighting chance and a bright future. Welcome to the podcast,
Thank
Dr.
you.
Manke. So the first segment, we're going to discuss the big C, that is constipation. While I was researching about this topic, a very staggering statistic came to my knowledge, that is the prevalence of functional constipation in children in Asia can go as high as 30%. So before we go further, Dr. Ajit, can you please help us understand what is functional constipation in children?
See, I think essentially what you need to know is constipation is by definition difficult to pass hard stools. So actually the frequency is not so important as to the consistency, because if it is hard, it gets painful. If it gets painful, it becomes difficult for the child to pass. So any child who even passes a stool every day but it's very hard also needs to be treated as a child who passes once in 3-4 days.
Okay. And Dr. Zoe, what are the signs that parents should look out for that might indicate constipation in their children, and what is the cause of concern?
It's a good question. See, the thing is, there is a big confusion about what goes, what can be accepted, and you cannot be running to the pediatrician every few hours or like a paranoid mother keep calling him all the time. But what happens is that when your child is training so much at stools, he turns red. He stands in the corner when he wants to pass stool. He doesn't sit to stool. That is the most important thing. So after 2 years of age, you have to sit to stool because then the pressure reduces drastically. So he doesn't sit to stool. He has dry stools and he's not feeling hungry. Appetite is reduced. He doesn't feel like eating. Obviously, anybody who has backed up stools is not going to feel hungry.
But
But that is what is most concerning. And that is the time that the mother should
parents should
go to the pediatrician.
Right. And Ms. Cheda, are there any food groups or lack of food groups that can cause constipation?
The most important food group is having fiber in your diet, right? So through vegetables, fruits, making sure you're getting enough fiber. Good high grain foods and grains in general are very good because you want to have oat bran, you want to have millets, they're high in fiber. The problem is when people think only fiber is required, you could also be constipated if you're dehydrated. So the kids need to have enough sufficient water through the day as well,
Right.
so that they're well hydrated and the motions are clear.
Okay. So you're saying fiber and water.
And water are the two most important.
All right.
Other thing, when you asked about red flags, one of the subtle signs that, a child is constipated is very often school-going kids tend to come back with their underpants stained with stools. That's called encopresis. So they hold back, but till they can't hold back any longer, so they end up passing a little bit in the pants.
Right.
So that is one of the subtle signs that, a child comes and complains of that. You have to look at it as a child with constipation and treat him accordingly.
And is that in younger children?
Yeah, younger children, small, toddlers who go to school, they're the
Right.
ones.
Okay. So the next segment is managing constipation with nutrition. Now, my first question is again to Dr. Jui. Is there a correlation between nutrition and socio-economic background?
Constipation. So the
Yeah.
constipation is universal, whether child is of a low socioeconomic status or affluent society. But the causes of both are different and should be treated differently. So what happens with a low socioeconomic family? Both the parents, everybody is busy. They are going to work. They don't have time to do much. They take their tiffins and go. The child is given a large glass of milk because it is considered nutritious, and some biscuits. It doesn't have real nutrition, just sugar.
Right.
So what happens is, whenever the child is hungry, we are giving him milk. Whoever is at home is giving them milk. They don't really have space to eat anything. And that is why with the milk and maida, you are getting constipation. That is the low socioeconomic. The opposite, like you're not getting nutritious food. It is exactly opposite in the affluent society. It is like a overabundance of everything possible, but you choose junk food.
Right.
Okay, so it's like everything is available, but peer pressure. You go to parties, you go to school, somebody in school has a birthday party, you go to that child's house. They have, what is the typical thing? You have cake, you have pizza, you have some pasta.
Yeah.
That is what is there. And then you end up getting that at home also.
Right.
So you end up, okay, my child does not eat this.
Right.
He will have only pizza.
Yeah.
So that is what needs to change.
Yeah.
That is the cause of constipation in a child of affluent society.
Right. And Ms. Cheda, are vegetarian or vegan diets sufficient for children?
They are, absolutely. I think the important thing is making sure there's balance in your nutrition. Now, whether you're a meat eater and you're a non-vegetarian, if you don't have enough fiber through plant-based foods, or your vitamins and minerals are low because your macronutrient and micronutrient intake is not in balance, you will end up getting constipated. So if you're vegan or vegetarian, if you're having enough fiber, enough good protein, good fat, good grains, it's all right. So I think it's important to make sure there's balance irrespective of your choice of food.
All right. Anything to add to that, Dr. Ajit?
Yeah, I think when you said vegan, I think non-vegetarian children are more likely because they don't eat enough vegetables and greens.
Right.
So it's an imbalance between the protein, the fiber, the fluid intake is what eventually causes constipation.
Right.
So it has to be a balanced diet. Even if you eat proteins as a non-vegetarian, you have to have greens or fruits to give the fiber for the formation of stools.
Right. I think the next one is probably one of the most important questions of this podcast. That is, let's discuss the role of milk. And I'd like to address this to all three of you, starting with Dr. Zui.
Whenever, the patient, the child with the mother will first go to the pediatrician. Okay, then when it gets, it is impossible to treat with many laxatives. Okay, today the patient will not only go to one pediatrician, they will go to many pediatricians. They have gone through a lot of laxatives. But when they come to me, the commonest thing that I hear is that the child is having milk and only milk. So it's not even like you are having milk, but you are having milk. If you are not having anything else, then the grandmother or grandfather, whoever else is in the extended family, will say that at least let him have milk. So that at least let him have milk is something which needs to change.
Yeah.
So I would say, in my mind as a surgeon, that is the first question I will ask, because that is the thing that causes constipation, along with other bad eating habits.
Right.
But I would direct it to you because he is the first person who is going to see that. But bad, in my mind, milk has got a bad name.
See, milk is essential for an infant, let's say. But as you grow older, the dependence on milk has to go down. So as long as you have milk in moderation, it is fine. So I guess up to 2 glasses, that's 400 ml per day, it should be the upper limit of milk that they should be having. What happens in our scenario is, One is in infancy, people think that chubby is good and healthy, that's healthy, but it's not actually healthy. Too much of milk, too much of formula tends to cause nice chubby babies, but they have constipation, they have iron deficiency, anemia, and other nutritional deficiency.
Right.
Secondly, if a child is not eating or is a fussy eater, as Zui said, people just say, okay, अरे खा नहीं रहा है, let him have at least milk. And that milk as a replacement for food is a bad concept. So food is food, it has its place. Milk has milk, it has its place, and anything in moderation is fine.
Right.
But an excess of anything is bad for the child.
Right. That's it.
I'd completely agree. I think when we get a question from parents saying, is milk good? And now with food preferences, like you had asked me, whether you're a vegan, then obviously no milk products are there.
Yeah.
But you can find calcium and protein through other food sources. So greens in general, vegetable greens are quite high on calcium. Nuts, seeds are high on calcium. So I don't think milk is necessary. But at the same time, in moderation is good. Like I personally, as a good example, I'm vegetarian and my child is vegetarian. But when I spoke to doctor as well, 2 glasses of milk in a day was my choice.
Right.
But you also can give milk in other forms such as curd, because it's a probiotic, good for the gut, actually helping constipation.
Yeah.
Paneer in source of protein.
Right.
So I also think moderation is the key.
Right.
Milk is not bad personally, but it cannot replace your other nutrients.
Right.
And the third is, if you do make a choice of becoming vegan, which is a personal choice, that's absolutely fine. But then making sure that protein and calcium sources are available from other foods.
Right. So the
Then-
solitary dependency on food is
Exactly.
not.
But there is another thing. So whenever we counsel parents who have constipated children, when we say that, okay, please stop
Reduce.
milk for some time, let a month go by, and then we will see. So in their mind, if we don't say that, I'm not talking about milk products, like, then they will stop everything.
Correct.
So curd, as you said, is actually good. Paneer is good source of protein. So when we say milk, it's only milk.
Yeah, we're purely talking about milk
Milk.
in its original form.
Yeah. Next, we're going to talk about the role of irregular snacking, excessive screen time, and lack of physical activities in children. And does that have a correlation with constipation, Dr. Ajib?
Yeah. See, I think irregular sense. The whole principle is for a child to eat well, he has to be hungry at a mealtime. Okay, if they keep snacking irregularly, they were never hungry at a mealtime.
Yeah.
They eat the wrong kind of food, which might be junk food, and at the same time, whatever like snacky food, and at the expense of proper nutritious balanced diet that they should be having.
Right.
Secondly, when you say screen time is the biggest bane, if you ask me today, is the biggest curse on children, because too much of screen time means, one, less mobility, less exercise, they're sitting at one place. Secondly, when they're watching the screen, it's like robots, they're totally hypnotized, and they just put whatever you put in their mouth, they just goes in, they don't even know what they're eating. So they cannot appreciate what they're eating, they do not know when they're full. So the commonest cause of even obesity is eating without, you sitting in front of the screen and eating
Right.
and snacking in between meals.
Right.
So these are kind of things that you have to avoid to the best of your ability, and never use a net or the screen as a nanny to keep children quiet and to help them eat. So encourage them to feed themselves.
Yeah.
They should know what they're eating and they should eat mindfully. And you don't give them an option other than a balanced spread that is in front of them.
Right. Anyone wants to add anything to that?
So about the screen time, I remember a very funny episode. See, what happens is when we tell the parents, okay, your child should sit on a potty seat for 10 minutes in the morning, 10 minutes, turn that into a fun experience, like you do something else with them, whatever. As a part of toilet training and constipation, you sit, because they are standing and stooling. So sit and stool and take that 10 minutes, you sit in front of the child and play something. So one mother just, used to show him the screen. Over a period of time, he refused to go to the loo without the screen. So it forms connections in your brain also that, this is the eating time when I need a screen in front of. So that should not happen.
Right.
So just adding to the same thing, as an expert, we work on lifestyle changes, whereas, the doctor is looking at clinical conditions. We're looking at long-term changes that, you should make at home. So one is not eating in front of the screen because there's no appetite control. They don't chew their food well. Big issue when, kids get constipated. And secondly is what we've always, all experts talk about, is making sure that it's family time, eating together. That's the only way the child will learn to eat what you're eating as well. Because it's also a social thing together, right? So if you do that as a practice, the idea is to build structure. Same thing with snacking. If you have a structure, kids are fantastic with routines and they work well. They're almost clockwork.
Yeah.
So if you do that with their sleep, with their food and a routine, same thing with junk, making sure that, their food habits are in such a way that every 2 to 3 hours, you give them a meal which is sufficient and balanced. They will not ask for the next thing, right? But if they're not well fed and you're randomly just feeding them because, as a mother, as a nutritionist as well, sometimes I feel like, oh God, she's not eaten. What should I do? But should I bring out another option? But then the child understands that there'll always be another option.
Right.
So wait it out. It normally takes about 2 to 3 days for them to understand that this is how it's meant to be. So I think creating a structure, making sure that, there is a routine, no screen time as much as possible, and go about it accordingly.
Probably label it as diet discipline, okay?
Yeah.
And that should be inculcated from as early as possible.
Yeah.
So interestingly, you talked about routines. Okay, so children are very, very comfortable with creating routine. Most constipated children that I see are sleeping very late at night, getting up very late in the morning. Their meal times are different from their families. So, and there is no specific structure to their
Correct.
eating times. So, or sleeping, getting up, and these are very stubborn children. So, I think the first thing as a part of dealing with constipation is to create a routine for parents as well as for the child.
Absolutely. It has to be in the environment.
So the next thing that we're going to do is give a label to these food items and their association with constipation. Either it's a big no or a big yes or somewhere in between. So let's start with caffeinated drinks, Dr. Ji.
Absolutely no.
Absolutely.
Big no.
Big no.
Big no from all of us.
What about instant noodles?
Big no from me. Absolutely no.
Yeah, because it doesn't give you any other nutrients except for just
Calories.
Yeah, we call it empty calories,
Right.
which means no nutrition. It's just giving you caloric value. Plus, it comes with preservatives, a lot of additives, which are bad for the gut.
Yeah.
It is
and at the expense of good food. That's the whole thing.
and also causes constipation.
So they fill their tummy, but they don't get nutrition.
Right. What about Indian sweets? We've all grown up eating Indian sweets. What do you feel about that?
Somewhere in between, anything in moderation is fine. Anything in excess is bad.
Right.
So as I said, sweets should not be at the expense of anything. Just because he eats 5 sweets instead of food, that's not okay. And a small quantity, maybe and it can also be used as a reward.
Somewhere in moderate. Somewhere in the middle.
I also think, I know up to the first year, you're not allowed to have salt and sugar. So anyways, that's out of the picture.
Yeah.
And you don't want sweets to be dipped and drowning in ghee. Ghee is great for health, but the idea is moderation. So you can also use healthier alternatives now. And grandma recipes actually had that, right? We were using less refined sugar. So Indian sweets can also be made in a healthy way.
Right.
And then in moderation, it's fine.
All right. And the last one is chocolates. Everybody's favorite.
Yeah, it is all of our favorites also. But in moderation, yes.
Fine.
Yes.
I also believe with sugar specifically, time of the day is important. So when people have
That's a good
chocolate
point.
and they have it late at night, that's spiking insulin and causing a lot of issues with hormonal balance as well for younger kids and, pre-puberty kids as well. So
Right.
I think if you are having chocolate, a piece only, we're not running through the bar, maybe twice a week, thrice. So don't make it a routine. Shouldn't be back-to-back days and before 6 in the evening because we don't want to have sugar once the day sets.
Good point. I said in the introduction that Dr. Ajit is very good at calming nervous parents, especially young mothers. So let's talk a little bit about transitioning from mother's milk to solids.
Yeah.
What is that process and is there again an element of constipation that could come in the way?
Yeah. See, I think let me just go through some basic concepts. One is milk is what the children need in the first year of life. Wherever possible and preferable is mother's milk. Beyond, say, 6 months, mother's milk alone is not nutritionally enough for the child. So we start non-milk supplemental feeds. So that means we start natural foods with 2 concepts. One is to, introduce different textures and consistencies of food, get the child used to the concept of chewing and swallowing, and eventually our plan is to replace 3 of your milk feeds with 3 non-milk feeds, which could be thick soups, it could be mashed fruits or vegetables, it could be cereals. So eventually, over a period of a month or a month and a half, you're replacing 3 feeds. So 3 feeds in the child's, in the infant's thing should be other than milk. Okay, and then as the child gets bigger and eats more and more stuff, he might drop an occasional further milk feed. So by the time he's on the first birthday, you're on to just 2 milk feeds a day.
Okay.
That is the general concept.
Right.
As far as possible, you try to use natural foods, no salt, no sugar, and try to make them as thick as the child is willing to have it as per his ability.
Right. But if done incorrectly, is there a chance of the child being constipated?
Yeah, there is, because see, by and large, breast milk provides enough fluids, and milk, water for the constipation to not happen.
Correct.
But if sometimes you give the wrong foods, you can end up getting constipation.
Right.
And if you start getting hard stools while weaning, particularly in hot weather like ours, then you might need to start giving some free water as part of the food. But when people are on formulas, diluting formulas is one of a common cause of constipation. Over dilute formulas.
Didn't know that. And Dr. Zoe, what are some ways one can manage constipation, whether in infants or toddlers or later on, with home remedies?
So there are a lot of things which our grandmothers used to do, which we have given up on the way, and we have taken up many bad habits. But there are some things like overnight soaking of raisins and figs, dry fruits, and consuming them in the morning. That actually solves a lot of problems, and many patients on that also are relieved. So there are many things like you have warm water in the morning with lemon, that also helps. So these are the things, or including fruits in your diet. Fruits like papaya or banana, apple. Though banana has got somewhat of a bad name where constipation is concerned, in my practice I have actually seen the opposite, in the sense that it increased bulk. So I think that is a good flax seeds, all of these things, or all seeds actually really help constipated kids. So these are some things that should be given to children who are constipated.
Right.
Now, when we look at Western literature, and some people come up with, what about prunes? Should we give prunes? They're not easily available,
Yeah.
So you can, yes, it is very good to give prunes, but you can give dates or you can give raisins, and you can give, and that solves the problem anyway.
Right.
Okay, so I would say that stick to simple things, and most of it will work out as long as you have a schedule to it.
Anything to add to that? Or?
No, I think same thing, but availability of food is very important, and seasonal is really important. So sometimes people want to just get food because it's good for health, but if it's not available locally, we're not getting the best quality then. So stick to seasonal and local, and make sure there's a routine. Again, you can't do it for one day and then expect miracles to happen.
Right.
For something like constipation, which can be chronic, it's making sure that it's happening over a period of time.
Right.
See, also I feel that's all very, so most mothers who come to me have gone through the pediatrician and are already frustrated. Okay, I think it is important for us to tell them ways and means, because the child is saying, I am not going to eat. This, what you are saying, is all very well for us to say that include these things in your diet. The child is saying, I am not going to eat. What do you do? Okay, so therein lies your empathy, that you say that, okay, you can hide these vegetables in this sort of, hide these vegetables in parathas, hide these vegetables in whatever he is eating. Give it in his hand, let him eat the way that he wants. Keep it. If he eats, doesn't eat it, forget about it. So I think a lot of frustration of the mother and parents also transfers to the child.
Yeah.
So many times when we are saying a lot of things, when they are trying to do something, but it's just not working, so you have to have that sort of a thing also, that try to find ways to inculcate them in his normal.
Yeah, basically what she's trying to say is, see, constipation is not an overnight story.
Right.
It usually happens over time, and once it gets established, it's a vicious cycle. It's the hard stools, painful passage. So painful passage causing them to hold back because of the fear. Till the fear goes away, they are not going to pass every day. And that kind of makes them hold back even further. So to break the cycle, it takes a long time. So the longer the duration of the constipation, longer the duration of the treatment. Think of it that way, for it to reverse. Okay. Having said that, intervention. That's why right from the beginning, if you intervene good diet, discipline and habits, then these things don't come to a head like we have to refer them to ZUI.
Yeah. We're preventing it in a large way. Yeah.
Yeah.
So that actually brings me to the third and the last segment of this discussion, that is long-term implications. So when does an innocent concern like constipation lead to surgery? I'll start with you and then maybe you can follow on.
Yeah, see, constipation, as I said, part of it is in the mind of the mother, part of it is actually there.
Yeah.
So, what constitutes constipation? I told you. So,
Right.
sometimes in new infants, in particular, newborns, they pass stools once in 6-7 days. Also, that's fine if they are only on breast milk. That is not constipation. But then the parents get worked up about constipation. That's not the issue. It's that when they start passing hard stools, or when they have any of the red flags that Zoe mentioned, like encopresses or standing in one corner and passing, all these kind of things are dangerous situations which lead to long-term constipation. They have to be tackled as early as possible and to prevent any further issues.
Right.
When they come to a stage that is so hard that while passing the hard stool, you end up getting a fissure, which makes it even more painful. Or sometimes there are surgical causes, medical causes like hypothyroidism or a Hirschsprung's disease or some surgical causes which cause constipation from a very early age as well. So those are the ones that have to be identified and referred early. The rest are more of lifestyle modification, coaching the parents how to deal with it, and making sure the child doesn't loses the fear of passing stools.
Right.
So too early toilet training or delaying it for too late. These are again problems. People want them to get trained at 9 months and 10 months. It's not the age to train children. Children have to know that it is a voluntary function that they can control, which comes only by around 2 years. Yeah. So you can't try to force them
Right.
or train them too early. You can create associations like Pavlov, like when they're potting, you put them on the chair or associate the chair with the stools, but can't train them to pass stools.
Yeah.
So these are issues that are part of the growing up process, which have to be remedied and tackled at that age. And then when it comes to a head, then it's her problem.
It's a problem. So happily. So
Beyond medication. So you can try some medicines, but eventually if that fails, then they have to be sorted.
So what happens is when I see a child of constipation, it all depends on the age also. A major thing of all pediatric problems also depends on the treatment depends on what age the child has come to you. If the child is a baby with constipation, I would be more concerned. If it's like a 2-year, 3-year-old, that is ideally the time where they are going to be concerned about constipation. Nothing is working. There are two things. Okay, one is anxious parents gone to one pediatrician, taken one sort of laxative, not given enough time for it, and gone to another pediatrician. Then again same thing, gone to a third pediatrician. So when they come to me, I first get it written down from there. At 1 month, you have to stick with it. All right. Then there are 3 parts of it. There is a diet, as she has said. There is a behavioral thing, scheduling, sitting to stool twice a day, and third is medication. So medication, the most common thing that people do is they start with a laxative and then things are fine, so they stop it. So it's not like that. The dose has to be tapered because the body is used to a certain time. So once they have gone through all of this and still it has not worked, that is the time that we will look for other things. So when the child has already seen a pediatrician and come, they have already ruled out all the medical causes like hypothyroidism, anything else, structural problems, everything. So what I have to look at, 2 things. Is the anus normal? First thing. Is it properly situated within the sphincter complex? Okay, sometimes there are problems there. It is a very small anus. There are structural problems which need to be sorted out. Then the job is easy. You just sort it. You just do an anoplasty, do a small procedure and it is fine. Second thing which needs to be diagnosed is something which is called as Hirschsprung disease. So when the baby is developing, the nerve endings and the nerve supply starts developing from the mouth, and the last thing to develop is at the anus. So the ganglion cells and all the nerve fibers come there the last. So if the child is preterm or if it has not formed well, it has arrested for some reason, the lower part of the rectum or anus is not innervated. So it is like tight like this. So it takes a lot of pressure to pass. So this can be diagnosed with like taking a biopsy, doing a dye study, doing all of that, and it needs a surgical procedure to correct. But out of 10 patients who come to me, or rather maybe 50 patients who come, one may have hospital disease. Okay, so it is still not very, very common.
I'm just saying more than 100 or 150 or
Yeah.
200 patients that we see, one might
One
have a
might
surgical
Have
problem.
that. Otherwise, everything can be managed.
Through
So
lifestyle.
we try very hard to manage it conservatively without surgery till the time that you're 100% sure that okay, nothing has worked.
Miss Cheda, when is the right time to educate your child about macronutrients, micronutrients, and what can go wrong if they're not taken?
So I think, in all honesty, I feel it starts from the beginning itself, and it starts from the parents, because what parents eat, if I'm not following a balanced meal plan, there's no way my toddler or my newborn baby is going to understand. The first year goes in the whole feeding process, breastfeeding, weaning, solids. But I think after the first year, when they do comprehend, I think it's about starting the balance then. It's not about explaining the concept, it's actually doing it at home and eating the same meals and creating that balance at home. Then, when they come to that age, which is between 4 to 6, their comprehension again gets further improved. And I do believe that time they can understand simple concepts. So, with my own daughter, I think what we've started to do is to tell her which foods will give her good muscle. So, she understands if I eat dal, if I eat, protein, I will get good muscles. If I eat my vegetables and fruit, my tummy will not hurt and I will, I'll get good potty. I mean, simple terms like that,
Right.
which the toddler understands. Once they come to grade 1 to 4, we actually in schools also look at introducing concepts, because they start to understand what macronutrients are: grains, milk and milk products, protein, which is dals, pulses, etc. So I think the concept is education and awareness in schools, and also parents talking about it and practicing it more than anything else. You have to walk the talk, right? So if you don't do it at home, your child is going to, they almost resonate with what you do at home. So starting that at home would be the first thing.
Yeah. So I think that's something that even I believe that often parents underestimate how much a child can comprehend at a young age. So I think the younger we start, the better it is. The last question for everybody before we end this: what is the one thing that you wish more Indian families understood about nutrition to avoid the problem of constipation? Constipation, yeah.
I think the first and foremost thing is that whatever the child wants, the child should not get. It is not that, see, we pamper our children. So there are so many hands to pamper. There is parents, then there is grandparents, and they're all so close. So they want to see the child happy. So most of the time, whatever the child wants, the child gets. Either if not from parents, he knows he's going to get it from his grandparents. So I think there should be a consensus in the family about what is good for the child and what is not. So I think that is in an Indian scenario.
So as she said, overindulgence is one issue. Secondly, I think the basic concept now, see, an average Indian diet is a balanced diet. So the concept is the child should be eating from the family pot, and because he's part of the family, so the whole family should eat the same food.
Right.
So by 18 months to 24 months, there should be no separate cooking or baby food for the child. Once you understand that, then he has no choice but to eat what is made for everybody, and automatically the diet gets normalized, of course, with a little tweaking and avoiding all the wrong things.
Right.
So I think that's very important for them to understand, and lots of water, okay? Now with schools being air conditioned, houses are air conditioned, cars air conditioned, people don't get that thirsty. So children drink less water.
Right.
So fruits are always at the short end of the stick. People don't get the fruit. So maybe keeping the evening snack as only fruits. That is also one idea of strategy of making sure that they have some fruits.
Right.
So doing such small tweaks
Right.
in the lifestyle
Right.
can go a long way in preventing constipation.
I think we follow the 80-20 rule for everybody, right? So I think in the household, when you want consensus, we say you can have 2 meals of your choice. So it keeps everybody happy, grandparents and the parents and everybody, where 2 meals, and it doesn't have to be cheat days. We call it 2 meals, where it could be something of their choice, because there's such predominance of processed food, sweets, sugar, all of it. Second is we call it don't pressurize. So don't force feed, because I think that starts to create an aversion with food and your mind at a very young age. And the second is don't empathize, where you say, oh, my child has not eaten, let me give whatever the child likes and try bringing out more options, right? So don't pressurize, don't sympathize or empathize. The last is, we call it the 5-finger rule. So I think it's very easy. India is, and this is where I think when I have to work with parents, we have parents from different cultures, different zones. Like he said, Indian diet originally has a good balance. It's just when we start piling up and changing it up, right, as per our food choices and preferences. So, we have Gujarati households, we have North Indian households. So locally, what is available to you, you want to pick that. But the 5-finger rule is 1 grain, good high fiber grain or carbohydrate food, protein, good fats through nuts, seeds, oils which are good, cold pressed, ghee, fruits and vegetables. And if you have all 5 in a balanced meal, it's fine. The problem starts is when you start to pile up one thing. For example, we are a little carb loaded sometimes in India. So you'll have rice and you'll have roti and you'll have potato sabzi, which is actually not a sabzi, it's a starch. Then you end up getting a load of one food only, and then the other things get compromised. So I think if you follow a balanced meal plan where you're making sure all those 5 things are there, no matter where you come from culturally, what's cooked at home, you will manage the food well.
I think lots of great tips for parents. I want to thank everybody for taking their time out and coming here for the podcast. Follow us for more tips and advice from science-backed, evidence-based discussion.